Well, good morning and welcome to another edition of Expert Alert. I'm Jim Tabor. This is where we invite different businesses from along the Gulf Coast to share information with us that could do things better for you, whether it's in the field of medicine, financial, or whatever. So today we have back in the studio with us from Integrated Medical in Gulfport, Sonny Elmer, who is the office manager, and Anthony Anderson, who is the posture technician there.
That's right.
So if you would, Sonny, tell us a little bit again about, it's been a month, about Integrated Medical.
We're primarily a family practice. We do focus on family medicine as wellness visits. We do sick visits as well. If you have high blood pressure, come see us. But we also have the aspect of the integrated part of our facility as well, where we offer some knee injections, hair restoration, bioidentical hormone therapy, and then, as we discussed last time, the posture that I had with Anthony here. So I introduced him without him being here on the last segment. So I figured why not bring him today so he can go into detail
Glad you're here, Anthony.
about what he offers, because hearing it from the expert is a lot more efficient than me just saying what I had done. It works very well, but I think with him discussing it, it'll kind of help people understand.
We'll share with us exactly what you had done.
So like I had said last time, I was suffering with some back pain, and then mainly my knees were hurting as well. I didn't realize that it was a problem coming from my hip. I had no issues with hip pain at all. But when I saw Anthony, he did the evaluation, and I had one hip that was slightly off from the other one, and he set me on the table. We did some posture techniques. He did some releasing of a few muscles, and I haven't had issues with that hip at all, ever, but I was able to sleep on my stomach again, because I am a stomach sleeper, but I was mainly sleeping on my side, which was messing up the rest of my body. And so now I can sleep on my stomach again, and I mean, I can't
sleep on my stomach. I'll sleep on one side
every
and
day.
the other, whatever.
I didn't realize it was my hip that was the problem at all, and he came along and that definitely fixed it.
Good. Well, tell us a little bit about yourself, Anthony.
Well, okay, so I'm a human movement specialist through the Brook Bush Institute of Human Movement Science. I'm a certified posture expert through the American Posture Institute, as well as a few other certifications and credentials. So I was going to tell you earlier that I suffered from a low back pain injury at 24 with no apparent injuries, no accidents, traumas, or surgeries. And lo and behold, it was the strength and stability of my structure that was the problem. So typically what happens is our bodies are very adaptive, and if you do repetitive actions or hold repetitive postures, those can create this latent pain and dysfunction and degradation. And so you have to train your body in order to keep it strong. You have to keep it balanced. And there's a specific way, evidence-based way of finding this out.
I guess it all depends on exactly what the problem is, because there's so many of us that probably feel like you're just a little bit off key. You are. Your body is just not quite. You can't figure out exactly what it is, but you're a little bit off center. And these are things that can, if you let them go over a period of time, they could cause you some major issues.
Yeah, headaches, plantar fasciitis.
I know I was reading the list down here and everything that, low back pain, headaches, knee pain, hip pain, patellofemoral pain syndrome. What is that?
It's runner's knee. Yeah.
I don't run. So I do a fast walk, so that's about it. Increased potential for serious injury. And so you say with just 15 minutes a day, chronic pain can be alleviated?
Yes, there is an evidence-based approach to actually diagnosing and finding out where your dysfunction lies. Typically when the joints begin to lose their range of motion, then it starts this whole cascade of injury where the tissue gets inflamed, adhesions start to form in the muscles, blood production starts to slow down, and there is an evidence-based way of moving the body so that we identify where those problems are starting.
Now, that's one of the things we were actually talking about before we came on the show. The fact that I just recently, within about four months ago, got back into doing something that I did 27 years ago, and that's Taekwondo.
Right.
Martial arts, which is a lot of leg and hand techniques and everything. and I mentioned the fact that there was, so many points that my brain saying, remember you can
Yeah,
do this,
right.
my body's going, no, you're 64 now, you can't do that. But you were saying that you could actually help
You can.
to
Age is,
get back into that.
doesn't have to limit you.
I mean, I feel great
Sure.
besides that. I just have if you feel like I got some limitations where I can't do those jump spin kicks like I used to.
Well, there's just a specific protocol for identifying why you can't do that, and I have the 15-minute routine that you can do daily.
And do that a little bit at a time. Now, tell me how all this works as far as, the assessments and muscle and everything.
Sure. So you come in and we go through a dynamic movement assessment that identifies where your potential problems are lying in the ankles, knees, hips, shoulders, and your head. From there, we go into more specific testing where we actually measure the joint range of motion. That gives us an objective marker so that we can make sure that you're having improvement. Next, we'll do specific muscle length testing and muscle strength testing. And from there, that helps me identify where your overactive synergistic muscles are, where your underactive muscles are, and how we could potentially mobilize the joint to get it to move better.
What are the benefits of doing this? I mean, you talking about you don't have to necessarily be an athlete.
You don't
to need this.
No,
I mean,
everybody needs it.
There's so many of us out that spend our whole days slumped over a computer.
Right.
I've only seen one person in my life that used to work here that had the most magnificent posture I've ever seen. She sat up straight and she was on the keyboard just like this, and she was unbelievable. But just doing things like that can cause you some issues.
It can. It can. Like I was saying earlier, the repetition of bad posture, quote unquote bad posture, which basically just means any deviation. If I engage a muscle or I shorten the tissue, the brain is going to register that, and it's going to try to adapt to that and make that the new normal. But that's not normal.
Right.
So when you try to return to your normal position, I like to use the analogy of a bed sheet. If you ever put the fitted sheet on a bed and you pull one corner, what happens to the other corners? They all migrate to that tension.
Right.
So this happens throughout every portion of the body. So the benefits to that would be you would become more balanced. You're able to sleep, like Sonny said, on your stomach again. You can alleviate low back pain. You may have a shoulder range of motion issue, pain picking up the kids or bending over to do the dishes. That can all be restored and alleviated.
So you just work in different ways depending on, it's not necessarily just the lower back.
No.
There's so many different other points of the body that you're
Correct.
having issues with.
TMJ, headaches, migraines.
Really, TMJ?
Oh, yes.
Really?
Like I said, it's the muscles contribute to the dysfunction. Your brain doesn't know it doesn't differentiate between something that's overactive or underactive. It just says, okay, this is the force that's being placed, and I'm going to maintain this force. Well, if that's not the muscle that does the action, it doesn't know the difference. So you're stuck in this perpetual state of dysfunction because your body thinks that one particular set of muscles does this action. And then you get the symptoms, the pain, the tightness, the knots.
And as you said, once you start doing this repetitive thing, your body thinks, oh, it's supposed to be this way.
Right.
And so whenever you're sitting at that desk all day long, and sitting on that computer, and you start to get up, it's like, okay, I have to move a little bit slower on that one.
Correct. I can help you identify what muscles are causing that and give you the recipe to strengthen the opposing muscle group.
We got a minute left. Tell me about how someone can set up an appointment or whatever to come in and get evaluated.
Certainly, you can either call Integrated Medical and Wellness Clinic. We're more than happy to accept
Numbers
calls.
on your screen there.
That's right. We'll take your appointment. We'll get you set up for an initial consultation. We'll get you in the door. We'll go through our assessment, and I'll educate you and give you something you can take for the rest of your life.
And I guess it just depends on how far along they are with their issues as to how long the
Yes, I have a phased approach. There's a 3-phase approach. So phase 1 will take you, it guides you through the process. You're going to start, I'll meet you where you're at. and we'll continue progressing you forward.
Awesome. Thank you so much. Very educational.
Yep.
Thank
I
you all
appreciate
both
it.
for being here.
you.
Thank you.
If you'd like some more information on that, you're having issues with posture or pains or anything that Anthony can help you out with, numbers on your screen, give them a call at Integrated Medical. They're located on Pass Road in Gulfport, just west, a couple blocks west of DeBees Road. Anyway, thank you for being here today on Expert Alert. We'll see you again on Thursday.
Thank you.
Yeah.
If you have a question for any of our experts, go to WLOX.com and click on Expert Alert. For a list of any of our upcoming experts, go to WLOX.com and click on Expert Alert.